talk about headaches. Dr. Tony is a neurologist here at GBMC. He trained in his residency in Allegheny General Hospital in Pittsburgh, and a fellowship in epilepsy and neurophysiology at Pittsburgh. And we've already had one question about, since you're originally from Baltimore and you've done all this training in Pittsburgh, who do you root for? That's what we really want.
Stand up!
Yeah. You don't have to answer that now.
Well, actually, my screen is purple, as you can see.
That is huge. So that's really cool. So, and then before we start, we do have a door prize, as we always do. And since Dr. Tony is going to be talking about headaches, and he's one of the many doctors that we have to help us, along with primary care doctors, with headache management, but I thought we would offer one of our patients the opportunity to have some relaxing music and sounds. This is a meditation system, music and sound, supposed to be to heighten your awareness and perception. And that also helps with headaches. And while you're meditating, you can also meditate with these little portable Zen balls. You make a funny little noise when you shake them around. It's very pleasing. I have a set of these myself. It has a little booklet to tell you all about relaxing. So in a stressed out world, everybody can use one of these. So that'll be the door prize. And without further ado, Dr.
Thank you. As Dr. Green said, I'm a general neurologist here at GBMC. I just started about 6 months ago here. I'm actually the only employed neurologist at this hospital. There's a couple of private guys, but I'm the only one that's employed. And so I see everything, inpatient, outpatient. I see kind of more trivial things like carpal tunnel to life-threatening things in the ICU. And as Dr. Green said, I did my fellowship in epilepsy, but so that's my niche in neurology, but I do everything in adult neurology. So, and also I grew up in Baltimore. I went to Catonsville High School and then University of Maryland for my undergrad, and so I am a Steeler fan. And but at the same time, living in Pittsburgh for 5 years, you can't not be a Steeler fan too. So both Ravens and Steelers. So the title of my talk is Headaches, It's Not All Migraine. The reason I picked that title is because migraine is one of the most common types of headaches, but there's hundreds of other different types of headaches, and they're not all migraine. And when I was a medical student, I thought treating headaches is one of the most boring things there is to do, but after doing a neurology residency, I now realize that there's a lot of nuances, a lot of different diagnoses, different presentations, different treatments, and so I think it's actually pretty interesting, and it's one of the things I see more in the clinic than any other pathology. So, do I go in here?
Not gonna say no.
I'm guessing it's this one? This one?
Looks like it. I can, there's a power button that I can turn on?
Oh, okay.
There we go.
Okay.
Oh, it's for the projector.
Oh, this is for the projector, okay.
I can do it manually.
Yeah, someone's gonna operate it.
Okay, okay.
Not a problem. All right, so to move forward, I guess I hit the...
Okay, so most people get headaches, and I found this statistics very interesting. 95% of people take at least one pill for a headache in the last year. I think, to me, it seems kind of unbelievable. That's what I read at a reputable textbook. 35% have recurrent tension headaches. 15% of the population have recurrent migraine headaches, and 0.1% have cluster headaches, which I'll discuss in a little bit. Next slide. So Definition of a headache is a pain in the head or upper neck. It is one of the most common locations of pain in the body and has many causes. So what causes the pain? Believe it or not, the brain actually has no pain receptors and cannot feel pain. But the nerves around the brain and the vessels do, and that's what can feel the headache in your head. And this picture I actually took as a fellow last year in the OR when we were doing epilepsy surgery. So we had the neurosurgeons open this guy's head, and basically we're going to take out a certain part of the brain that causes seizures. Unfortunately, it's a little blurry. I didn't focus it well. So there's actually an international body, it's called International Headache Society, that meets every year, and they classified headaches, primary, secondary, and there's a cranial neuralgia and facial pain and other headaches. And I'll discuss each one individually. Next one. So primary headache is any headache that's that is not associated with or caused by other disease. And these include migraine headache, tension headache, and cluster headache, just to name a few. So we'll discuss migraine because this is one of the more common types of headaches, but it's actually not the most common, it's the second most common. 28 million people have it, 12% of the population, more women than men, and more younger people than older people. So this is actually one of the nice things about aging, getting older. You actually get less headaches. And it's usually headache on one side of the head. But it's not just pain that people with migraines get. You can also have a heightened sense of sensibility to light, which we call photophobia. Photo means light, and phobia means fear in Greek, I think. And heightened sensitivity to sound, which we call phonophobia. And many patients also have nausea and some have vomiting. Some people who get migraines have a warning symptom called an aura before the actual headaches. And this is the artist's rendition of what his aura looks like. Next slide. And this is another aura where basically what you see is distorted. Some people have what we call photopsia, which is a sensation of flashes of light. Some people have scotomas, which is basically a black spot in their vision. And some people have what's called Alice in Wonderland syndrome, which is what we call macropsia, where things are bigger, and some have micropsia, which things are smaller. And there's some evidence that Lewis Carroll, the author of Alice in Wonderland, actually also suffered from migraine headaches, and a lot of his ideas were from his the sensations he had when he had migraines. And then there's something else that we call the complicated migraine or complex migraines, which are basically stroke-like deficits, numbness, weakness, blurred vision, difficulty talking, which really is almost impossible to distinguish from a stroke. So it could be a medical emergency, which stroke is, but migraine usually is not. And if you have any of these symptoms, especially if you've never had them before, I would consider that to be stroke unless proven otherwise. And then there's these migraine variants. For example, basilar migraine, which has a combination of speech difficulty, which we call dysarthria, vertigo or dizziness, tinnitus, which is ringing in your ear, double vision